This is COVID-19 with Dr. Richard Brown.
Hello, this is Dr. Richard Brown again, coming to you with another podcast. Thank you all for joining this week. This is July 27, 2022, and summer is still smoldering with record heat waves moving across this country. Unfortunately, the COVID-19 is continuing to surge and spread. It's not as bad as it was, but it's not gone away, and we're seeing pockets of spread throughout the country. And we have to be concerned about this. And we know that this virus will kill people. There's thousands of cases that we know about so far. So beware. Also, unfortunately, there's a new subvariant of Omicron. It's called BA.5. BA.5 is what scientists are looking at now as the newest variation of this virus. We know we had the Omicron, and now it's changed and mutated to BA.5. So I'm going to talk to you about an article that was written by Jennifer Rigby and Julian Stenhosen only a few days ago. And it talks about this BA.5. So 2 years ago, we learned a lot about the current coronavirus because we didn't know a lot about it. And once again, we're going to have to learn about this variation to continue to fight against this disease that's trying to kill our human family. So this was reported in the London Reuters. The BA.5 is part of the Omicron family, and it is the latest coronavirus variant and has caused waves of infection across the globe. According to the World Health Organization, most recent report, it was associated with 52% of the cases that was followed in the month of June 2022. And that's up about 37% in 1 week. In the United States, it is estimated to be causing around 65% of the infections. That's large enough that we need to be worried about this. So why are the numbers rising? Okay, BA.5 really is not new. It was first identified in 2022, January, and it has been tracked ever since by the WHO since April of this year. Now, who is the WHO? WHO is WHO, which stands for World Health Organization. And for those of you who may not know, the World Health Organization is a United Nations group that was established in 1948. And its concern is with improving the health of the population of the world and promoting prevention, and also controlling communicable diseases through various technical and project programs. So it is the organization that whenever there's an outbreak of a disease anywhere in the world, their scientists and people get involved, learn it, study it, and tell us how we need to fight it and control the disease so that we can stay alive. So BA.5 is the sister variant of Omicron. This is the strain that has been dominant worldwide since 2021. That's Omicron, that is. And it has already caused a lot of spikes in the rates. Even with reduced testing in countries including South Africa, where it first was found, as well as the United Kingdom and parts of Europe and Australia. So the BA.5 is out there and spreading. So why is it spreading? Well, like its closely related sibling BA.4, which we didn't hear a lot about, BA.5 is particularly good at evading the immune protection provided either by vaccination or prior infection. So even though you've been vaccinated, and even though you've had a prior infection even, you still can come down with and be infected by BA.5 because it's good at evading those protections that we already have. And so for this reason, the BA.5 has a growth advantage over other sublineages of Omicron. One of the scientists, Kirchhoff, who is a representative of the WHO, he's a technical lead on COVID-19. He told people 2 weeks ago, he said, for many people, this means that they are getting reinfected, often even a short time after having COVID-19. So Dr. Van Kerkhove said that WHO is assessing the reports that they're getting in about reinfection. So as they get new reports in from parts of the world, they're studying it because it's a learning experience that we have to keep participating in. We are still learning. It's an ongoing process. People live in a world now, especially in the United States, where things are black and white, things are this or that, things are exact or not exact. But when it comes to viruses and bacteria and studying these scientific, by the scientists, of course, it's a learning process. We have to keep learning and keep moving and adjusting in order to fight the disease, because it is mutating and adjusting, doing all it can to infect its human host and eventually kill them. So there's no question about it. A virologist from Poland stated that the vaccine must be developed for this as it changes its course and as it mutates. And so they're constantly evaluating it and studying it. It seems that it's pretty common now. And because many people got Omicron, researchers have suggested that they believe that both people who are vaccinated and who are unvaccinated are unprotected and they've been infected. And so I repeat, as I've said before in the past, that if enough people had been vaccinated from the beginning 2 years ago, we might not have this problem, or at least it would be smaller. But we know we got those that have not been vaccinated, refuse to be vaccinated. And so they're making room for and creating an opportunity for the virus to mutate and spread to them, which in turn spreads to others. Now, let's talk about the severity. While the cases are rising, and there's been some more hospitalizations in some countries, the deaths have not gone up dramatically. Okay, so even though this virus is out there, it's not killing as many people as the previous variant, Omicron. And again, this is largely because the vaccinations that we have had and that were given are somewhat effective against this BA.5. Still, you get severe illnesses, but not death if infected. And so the manufacturers and the regulators of the vaccines are continuing to monitor this virus, and they're tweaking the vaccines so as to directly target these new variants. As I mentioned, the BA.4, now the BA.5. So there is evidence that the BA.5 is more dangerous than any of the other Omicron variants, according to Dr. Kirchhoff of the WHO organization. He stressed also that there's spikes in cases, and they're putting a lot of pressure and risk on people to get long COVID. So we heard long COVID a couple of months ago that people are experiencing long COVID, even though they've got the disease, experienced symptoms, and then seemingly gotten over the disease. Weeks later, they develop headaches or coughs or shortness of breath, and they're terming that as long COVID, even though the original symptoms have gone away and that the virus does not appear and is detected anymore in the tests that are performed. So we're getting long COVID even from getting exposed to this BA.5. So it's an ongoing process, make no mistake. So the WHO and other experts have also said that the ongoing pandemic, prolonged by vaccine inequity and the desire in many countries to move beyond COVID-19, would only lead to more new and unpredictable variants. So the United States and other countries, they're so in a hurry to move past Omicron and the virus through opening up again and not wearing masks and not focusing on it, that it's allowing the disease to continue to spread. So scientists are already drawing attention to the BA.275, which was first identified in India and has large numbers of mutations and is spreading pretty fast. Again, the WHO said that the pandemic remains a global health emergency and that countries should consider public health measures like what we've been doing, masking, social distancing, especially when cases surge, alongside absolutely encouraging the population to get vaccinations. So what people fundamentally don't understand is that when there's a high level of community transmission like this virus is exhibiting, it will mutate. So we know, according to Dr. Poland, that there's other variants coming next. And he maintains in his specific words that we are playing with fire. We're playing with fire by not taking the necessary steps worldwide to defeat this disease. So also there are the naysayers, of course, that are still out there. These are the vaccine resistors. They're continuing to spread false information through their opinions and statements that they make based upon completely non-scientific research or evidence. So the disease continued to be publicized. I'm sure you've heard about that in one way or another. And it's kind of shaping up to be that if you're Republican, then you're more likely not to take the vaccination or to talk about those situations in which it may not be true or that it's a conspiracy theory designed to perhaps benefit the Democrats by encouraging things like mail-in ballots so that they can perhaps win the 2022 and 2024 elections. However, if you're a Democrat, you're more likely to listen to the science, take the vaccine, take the boosters, and encourage others to do so. So I've seen statements that say, oh, it's all a conspiracy. They're trying to win the next election. So I think personally that it's a great idea to mail in ballots. People are busy, even people that are poor. They are busy trying to get not poor, okay? And so to have a convenience of being able to mail in your ballot is a great convenience. I also believe that ballots and or voting should take place on weekends, like Saturday as well as Sunday. Way back when voting started, it was only the elite, people who owned land, that could vote. Now that we've made it clear and it's in law that all citizens can vote, then you should make it convenient for them, not just restricted to the weekdays, not just restricted to going to the polls, but we should have mail-in ballots. Now there's those who say, well, people might cheat. You know, well, I think we got enough technology that we can perhaps prevent some of that. So we should move on past that. And of course, others have vilified Dr. Fauci, who's the foremost expert on the viruses and contagious diseases. And so I really just can't understand why there are those people who continue to not believe in the science and not believe in accepting that we do have a pandemic and a virus that's killing us. I can't understand that, except if I accept the sad notice and sad understanding that a great number of people in the US have been brainwashed and maybe have experienced cognitive brain deterioration and that are incapable of recognizing logic. If I accept that, then maybe it's understandable. However, there is hope. There are many who respect the science and truth about the spread of the disease. I'm aware of at least one medical system here in Omaha that is taking steps to protect employees and patients in the midst of this pandemic. So they recognize that there had been a large number of staff not coming to work, absenteeism had increased, and it was due to the COVID pandemic. And people have been calling in sick a lot. So they recently issued a memo to all of his employees informing them about the now dominant BA.5 variant that is now pretty contagious. And so they're letting their people know that, and also letting them know that it evades those situations in which you've already been vaccinated, or if you've even had COVID-19 already, it can get around that and infect you still. So they're actually asking people not to come to work, which makes sense if they feel sick. They're explaining through their communication mechanisms that some staff people thought they just had an allergy or the start of a cold, and then 12 to 18 hours later, they became sick with sore throat, body aches, fever, cough, and shortness of breath. The organization also goes on to explain that they will accept home test results. Now, they have to send a picture of the test stick and the instruction sheet showing what a positive results looks like to their supervisors. Free at-home tests have been sent to most people in the United States, so they're readily available. Some chain pharmaceutical companies have also provided free tests to the population. So there's really no reason that we cannot defeat this virus except for the unreasonableness of the 30% of the population who refuses to get vaccinated and boosted. So that's all I have for this session today. This is Dr. Brown, and I'll see you around.
This has been COVID-19 with Dr. Richard Brown. If you'd like to leave suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.